I was a part of group 1, which included Ernesto, Ka, and Z. We got patients 31 and 281. Now for our first patient, patient 31, he is 3.5 years old. He attends daycare and his vaccination history is unknown. Him attending the daycare puts him at risk for a lot of germs to be around him, and also him being young puts him at risk, so he's definitely immunocompromised since he is so little. And then also he has 2 hallmarks of meningitis, which is the stiffness in the neck and the high fever. And right away we did notice that he had cloudy CSF compared to the normal one, and also a little bit higher absorbency, which tells us that there's more substance in the CSF, so more light to hit the objects in there. This was an early indicator that's a bacterial meningitis versus the viral, because there are more white blood cells. Now, when we looked at his numbers on his chart, the leukocytes were astronomical. So the leukocytes are in charge of the body's immune reaction. So this tells us that he's definitely fighting off a pathogen, and it gives us a glimpse into the health of the patient. He had very high neutrophils. An increased number is a common sign of systematic bacterial infection, since it was very high at 88%, and a normal CSF should have about 0. His glucose was lower, it should be in the 50 to 80 range, and it was at 19 because the bacteria is digesting the glucose. And a normal CSF should have the number should be between 15 and 60, and he's at 340, which is very high, and this protein number is due to having so many white blood cells in the CSF. Now we're going to go ahead and take it in depth into the cultures that we did. The first test that we did was the gram stain, where we first thought it was gram positive because we were seeing purple. However, we realized that it was gram negative. And the shape and arrangement was pleomorphic. So based on the environment, this pathogen goes from being like a round shape and then into rods based on the environment, but it's mainly a bacillus shape. And also it is gram negative, so it helped us narrow down quite a bit. The next test that we did was the chocolate agar and the blood agar. Right away we noticed that the blood agar did not grow any of the pathogen, so that means that this pathogen is very fastidious, and the one that would only grow on chocolate agar because it has enough nutrients would be the Haemophilus influenzae. This one needs a lot of nutrients, and that's what the chocolate agar provides. So now, just to make sure, we also went and did the catalyst test, which showed a positive result. So we knew then that it was not Streptococcus pneumoniae, because we were thinking it might be, but Streptococcus pneumoniae is catalyst negative, so we were able to rule that out. And then also the Thayer-Martin showed no growth, which indicated that patient 31 did not have the Neisseria meningitis. So we came to the conclusion that our patient does have Haemophilus influenzae based on him being at the daycare age, which is a big indicator. And also growing in the chocolate agar, being catalyst positive and gram negative. Now moving on. Now the treatment and prognosis would be antibiotics. Since this is a bacterial infection, it can be treated with antibiotics, and it's really important for him to get rest. If he does have trouble breathing, he should go to the hospital to get oxygen mask. He is contagious, so he should stay home, and anyone that was in close contact, especially family members, should take antibiotics just as a precaution. His body needs a lot of hydration, rest to fight off the pathogen, and also fever reducers would be very, very important because we don't want any brain damage to happen with the fever. Especially given that he's very young, the illness can be more severe in that age group. And there also is an HIB vaccine for this. However, it seems like he didn't get it because he wouldn't have gotten this bacteria. And then we would expect to hopefully not see any long-term effects, but if there is any complications that happen from the infection, the long-term effects can be possible. So he is at high risk from becoming seriously ill from this, so you have to definitely keep an eye on him. Now moving on to our patient 281. She's 85 years old, so she's elderly. This puts her at very high risk. She has a high fever and headache and weakness. This headache is exacerbated by light, which is also a sign that she has a viral meningitis versus bacterial, because usually with the virus strand, it's exacerbated by light. She also had clear CSF, which also is another indicator that it's a viral versus bacterial. That's why we see the CSF absorbency lower, because there's not as much light for the test. And based on her numbers, she has high leukocytes, high neutrophils. This is telling us that she is fighting off a pathogen right now. Her glucose is normal, which we would expect to see in a viral meningitis, and her high proteins are because the white blood cells are found in her CSF. Now we're going to move on to the in-depth lab results for her. We did an indirect ELISA for her. The immunoglobulin G are for memory response, so this would be an indicator for a pathogen that we've had in the past and our body knows how to fight it already, versus the immunoglobulin M, which is the first responder to the pathogens, the first antibody that's going to be fighting the pathogen. So that would mean that we are fighting this pathogen currently. So based on these results, her being positive for the IgM and negative in all the other ones, that would tell us that she's currently fighting the West Nile virus, and she probably was vaccinated for measles, mumps, and polio because she has long memory response in her antibodies. So based on that, her symptoms and the indirect ELISA, we come to the conclusion that she's fighting the West Nile virus. For her treatment and prognosis, she needs to get some pain relief and fever reducers, which can be purchased over the counter. She definitely needs rest and hydration, since her body needs more energy to fight off this virus. No antibiotics would help her because it's not a bacterial infection. It's not, contagious, because she is a dead-end host, and the infection ends with her. Just like if a horse was infected with this, they would be the dead end host as well. The West Nile virus is an enveloped RNA virus, and it's most common in children, but the elderly is like who we really need to be worried about, just because they are more, their body is not going to be able to recover as fast. So there might be long-lasting effects. This is very possible. And if she has any complications, she should definitely go to the hospital, because West Nile virus can be fatal. So she definitely needs to be careful with this and take it very seriously. There only are a few rare occasions where the West Nile virus is transmitted from person to person, which is just through breastfeeding, pregnancy, transfusions, and transplants. But besides that, she would be considered the dead end host, and it would just end with her. So we hope that she has a speedy recovery with no long-term effects.